Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you're tuning in to one of my live chat sessions on my YouTube channel. As some of you know, I specialize in the removal of cysts, lipomas, and also provide medical advice on a whole host of topics. So if you haven't checked this out, then do check out the videos. We're available at lipomacyst.com. Today's chat, we're going to be talking about COVID-19, the coronavirus, and how it's disturbing our sleep. This is going to be an interesting topic because tomorrow I'll be chatting live on LBC Radio with Nick Ferrari. That's at 8:45 GMT time tomorrow morning. So I thought I would give you a preview of what that discussion will be about and where that's come from. So if you have read about it, the recent studies have come out and said that because of the lockdown, because of the coronavirus, people have had disrupted sleep, or their sleep has been affected. Well, that is quite interesting. And so we need to work out why that's the case. What is it about the pandemic that's caused this? And what is it that people who report disrupted sleep are suffering from? Well, the data coming out is saying that over the half of the people that they've interviewed, some 3,000 people between the ages of 18 to 75, have all reported disturbed sleep patterns as a result of the coronavirus. So let's take a look at what might be causing that. We know that sleep hygiene and daily routine and stress all play a big factor in how we sleep. We also know that sleep is absolutely important if we want to live healthy, long lives. We know that if you disrupt sleep, you increase your chance of developing heart disease, cancers, and blood pressure. So if you get a good night's sleep, not only will you feel refreshed in the morning, but also in the long term, you'll be living a higher quality life. So this recent data is really surprising because what it's shown is that the coronavirus has caused sleep to be disrupted. Now, the two main things that are coming out of this is that, number one, people are reporting feeling not so refreshed when they wake up. And number two is that they're having very, very lucid dreams. The population group interviewed have reported, in fact, that their sleep has improved. And some may argue that the lockdown has given us an opportunity to revisit sleep and get some sleep better given our previous very hectic lifestyle. So what is it about sleep which is disrupted and why is it so important? If you've got questions about sleep, put them in the messages and I'll get to them at the end of the talk. So the first thing we want to talk about is why people have disrupted sleep. Well, we look at humans as very much creatures of habit. The body gets used to a routine. And pre-COVID-19, our routine was pretty much set in stone. For those of working age, well, they would wake up at probably about 6:30, 7 o'clock. They'd have breakfast. They'd produce their commute into work. They'd work hard. They'd commute back home. They may do some exercise. They may watch a bit of television, and then they'll retreat to bed. And on and on and on, that cycle will go on. However, with COVID-19, we've seen a number of different changes. The main change that we have is that the working population has very much had to change their work style. And by that, we mean that they've been working from home. So that means waking up at 7 o'clock for the early commute has been negated. It's no longer needed. So people have changed their commuting habits, their sleeping habits. So they may choose to sleep in a bit longer. Also, if you're working from home, you tend to be more relaxed. You may choose to have a sleep during the day, and therefore you may use some of that sleep pressure that you would have used at the end of work. We also have seen a really big uptake in people watching on electronic devices. We hear that streaming programs like Netflix have seen an absolute surge in their use. And so the use of electronic digital devices at night will also impair not only what time people sleep. So if you're binge watching your favorite Netflix movies, then you're going to go to sleep much later. But more importantly for sleep, you're introducing light at night. Now your eyes are a sensitive organ and they will detect light at night and they will tell your brain whether or not to sleep or not. So we've adapted to life on planet Earth where we have cycles of day and night. But when we introduce artificial light, the clock is being what we call desynchronized. Your brain is thinking it's still mid-afternoon, when in fact it may well be 2, 3 o'clock in the morning. As a result, those individuals may find that they take longer to initiate sleep. And when they do wake up, invariably at 9 o'clock or 8 o'clock, they don't feel so refreshed. So that might be an explanation as to why our sleeping habits have produced less refreshing sleep. And that's because the habits of our day-to-day routine have changed. But what about the dreams, these vivid dreams that people report? Well, we know that dreaming is really a subproduct of dissociative experiences. So those who are daydreaming during the day may go on to have very lucid, vivid dreams at night. The fact that people have been reported increased lucid dreams during the night would mean that maybe they are able to daydream a little bit more during the day. That would fit in with the contemplative atmosphere of COVID-19. People are spending a lot of time at home, reflecting on their lives and being able to think things in that more broader sense, as opposed to having to commute to work at the desk and come back without having the bandwidth to think freely. So that ability to daydream has also been translated into more lucid dreams at night. However, the additional stress that COVID-19 has brought, and that includes stress from catching the virus, so if you are self-isolating or whether you are confined to your home, then that invariably has an additional stress on your body. It causes your brain to release high levels of stress hormones, which will affect your sleep. We've also known that people have lost their jobs, people have been suspended from their jobs, or people who run businesses have reduced cash flow. And this will cause some inherent stress. And when you're stressed, you don't sleep very well, and you may go on to have sleep paralysis or nightmares. So, in a nutshell, we are seeing this disrupted sleep as a knock-on effect of the COVID-19. And it's come in two forms. Either we're sleeping more and we're enjoying the lockdown and we're catching up on sleep that we were deprived of, or we're changing our sleeping habits by having sleep at night, we're exercising less, we've got that extra time to be more contemplative and therefore think about things which we may bring into the subconscious, and therefore that may represent itself in dreams. So we'll be discussing all of that with Nick Ferrari on LBC Radio tomorrow morning. So let's take some questions from the floor. Enough of me talking. Let's go to the floor. Let's see who we've got on board. So we'll do a quick name call. We've got Rusty. How are you doing? Karen from Karen, where are you from? Carol Tom, how are you doing? Massively affecting my sleep. That's really interesting. Tell me how it's affecting your sleep. We've got Miss Simpson. Yes, can't wait to hear it. Yes, so tomorrow morning, 8:45, break of dawn, I'll be up talking to Nick Ferrari about sleep, COVID-19 lockdown. Rhoda says hello. Stacy says hello. Ellen from Illinois, welcome. I hope everybody in the United States is staying safe. I know there are some problems going on there, and I hope you all well. We've got Atta from Germany. We've got Karen from Arizona. We've got Sulalali from England. We've got Trenda. Hello, how are you doing? Rusty, sleep is all to hell. Tell me more, Rusty. I want to know your sleep experiences, everyone's sleep experiences. And tomorrow, when we go on LBC Radio, that's 8:45 GMT time in the morning, I'll be able to reflect back on everything you've taught me today. And I'll take some of your questions with me, perhaps. So, Miss Simpson, my disturbed sleep is part stress, anxiety, menopause, and that's been going on for 3 years. Well, you're absolutely right. I think the menopause, with its vasovagal and vasomotor effects, the hot flushes, the mood disturbances, certainly will affect people's sleep. That, compounded with COVID-19, will just exacerbate things even more. Miss Laura, how are you doing? How are you doing? What else we've got here? We've got Dr. Sarah from Smart Invisalign. If you've got any dentistry questions during COVID-19, she's the lady to speak to. She's got some great videos on emergency dental care, so tooth pain, toothache, denture questions, fillings, anything like that. Check out Dr. Sarah. We've got Laura James from Kentucky. We've got Gina from Massachusetts. We've got Lynn Crawford from Gainesville, US of A. New video, please, says Mrs. Asa. Absolutely right. We've got a lot of material that we're going to be editing. We're going to be releasing. We've been really busy. So that's going to be coming up, hopefully, if not tomorrow, then Saturday. So look out for that. We've got Rhoda saying, I'm curious to healthcare workers. There's a lot of work on those health workers who have been involved with the coronavirus and suffering sleep disturbance as a result of PTSD, that is post-traumatic stress disorder. So that's a lot of that's coming through as well. A lot of work coming through from people who have suffered COVID-19 and subsequently had sleep disturbance, as well as those who have had to do self-isolation with sleep disturbance. So there's a lot of information coming through about sleep disturbance and those who are directly affected, as well as the general population. So really we could look at those as two separate cohorts, those in the immediate COVID-19 sphere and those in the global population sphere. Let's take some more questions. Bridget, how are you doing? She's saying hello. How are you doing? Rhoda, how are you doing? Let's have a look. So a lot of these are in Spanish and Italian, and my Spanish and Italian is very rusty, so you must translate those for me. Let's have a look. So Ellen Mumford, I'm still sleeping well. I eat pistachio nuts about an hour before bed. They really help. That's really interesting. They contain a lot of tryptophans and they will help you sleep. So that's brilliant. Keep going on with that. Who else we have here? I'm not able to sleep, says Marilyn. 4 hours maximum at night. I start work as soon as I wake. Well, look, listen, there isn't a golden number of hours. And, you know, Margaret Thatcher famously managed to get on perfectly fine with 4 hours sleep. But some of the data is suggesting you should try and get 7 hours sleep to try and improve your ability to cope with stress, hold back aging, hold back the development of cardiovascular disease, obesity and cancer. So we've got Chloe Flick from Manchester. How are you doing? Don't forget LBC Radio tomorrow, 8:45 in the morning. We've got Andrea from Augsburg in Germany. How are you doing? We've got, who else do we have here? Miss Simpson saying, I've been getting up at 9-ish. I've worked from home for 20 years, so no real change for me. That's interesting. So those who have been in that kind of space, that working from home space, they haven't really reported any changes at all. So maybe it's just the people who are commuting and going to offices that have had the change in their lockdown habits. Sulalali saying, lockdown has changed my sleeping hours. Absolutely. So people are probably being a little bit less sensible with their sleep hygiene, probably sleeping later at night, waking up a little bit later, maybe taking some siestas during sleep. Therefore, you'll be difficult to initiate sleep, and when you do, you won't get that deep sleep that you need to kind of, you know, sieve all the information that you've had the previous day, file it into long-term memory, clean the decks, ready to take on some more information. And if you're not doing that in sleep, then what's going to happen? You're going to wake up more stressed, you're going to be more forgetful, your productivity is going to go down, etc., etc. So there's not only just short-term damage, but there's also long-term damage. So, Miss Simpson, had some crazy dreams. I've always been able to lucid dream. It's a nice escape from this world. Well, let us know about your lucid dreams. Karen saying, Doctor, have you ever heard of an inclined bed therapy? It's so interesting. No, tell me more. I've only heard of tilt tests, but I haven't heard of inclined bed therapy. Rusty saying she's agreeing with Karen. Laura James, I had bad dreams because I watched a movie about earthquakes and outbreaks. Yeah, well, absolutely right. I think if you're kind of daydreaming, watching films, that's going to seep into your subconscious and in your brain. When it comes to processing your memories and thought process from the day before, it's going to focus on that. So just focus on watching movies about ice cream and chocolate. So Steve says the NHS needs to prescribe melatonin, I reckon, and my sleep pattern was bad before, it's worse now. You're absolutely right. Melatonin is used, you know, very liberally in the United States. Circadin, you can buy it from a supermarket without prescription. In the United Kingdom, it is a prescription-only medication. Famously, it is the sleep hormone. It's used to combat jet lag and also initiate sleep in certain conditions. And it's interesting to see that you're telling us, Stephen, that your sleep is much worse given the coronavirus. Do tell us more. Sululali, Dr. Khaled, I have a friend of mine started to scream at night due to fears of many reasons. Well, Sululali, these sleep paralysis is because you're overthinking. Your brain is taking those thoughts that you're having during the day and then putting them into very lucid dreams or sleep paralysis or night terrors, which you're describing. The good thing is it's a sign of cognitive function. So if you've got high cognitive function, means you can have those dreams. But obviously, we need to kind of exercise more. We need to reduce our anxiety. There's a lot of stress now. Exercise is very difficult to carry out. There's no gyms. There's no none of the going to the park and whatnot. So yeah, exercise, which was there, they're much harder to get hold of. So, hi doctor, is there a relationship between HIV and the coronavirus? Well, they're both viruses. They're both RNA viruses. There isn't a connection in terms of transmission, though, although they're both very contagious. And by the sounds of it, there is no obvious treatment for either. Alexander May, hello from Andover. Hello, Andover from Hampshire. How common is it to wake up and have a short period where you don't remember not where you are, but who you are? Well, that's interesting, Alex. I think if you have a very deep sleep, the REM sleep as we call it, that's a rapid eye movement sleep, it may take a few moments to be able to bring back all that cognition into your mind to work out exactly where you are and who you are. But if it's happening on a frequent basis, we should look into reasons why. Is it something we're consuming before sleep? So alcohol consumption can sometimes do that. Is it some sort of sedation that we're taking that is perhaps suppressing our cognitive function? So that's quite interesting. More questions, really. Karen from Essex, how are you doing? Don't forget, LBC Radio tomorrow at 8:45 GMT time. Me and Nick Ferrari will be discussing COVID-19 and sleep. We've got Patty saying she takes 14 sleeping tablets every night. 40. I'd love to know what they are. Are they prescription or not? My insomnia, says Rusty, is totally out of control. Look, also, if you are feeling a little bit like an insomniac, then don't say that I said this, but go watch some of my YouTube videos because let's face it, if you're going to be awake, you might as well be watching my YouTube. So Mary Blair, how are you doing? Sue Lally saying it again. What time is your interview? It's 8:45 LBC GMT, catch online, digital radio, GMT 8:45 in the morning. Beverly from New Zealand, how are you doing? Laura from New York, how are you doing? Karen Essex, sorry, I should have said fantastic. Yes, absolutely. Ninja of Rock says, my sleep pattern is crazy now. I can't get enough sleep and feel physically exhausted all the time. And that's actually exactly what a lot of people, half the population, is saying. They're not feeling refreshed when they wake up. And that may be because we're dispensing of all that good sleep hygiene, eating early, exercising early, getting rid of artificial sleep, light at night that's disrupting our sleep, making sure that we don't have noise and heat that's will use up that sleep momentum that we've built up throughout the day. So yeah, it seems to be a global phenomena that everybody's having disrupted sleep and very, very vivid dreams. Let's have a look. Carol Tom saying, I'm only able to sleep 4 hours. I sleep between 2 and 6. And this is why she's using pills. Okay, that's interesting. Rusty says, even with my sleeping pills, it takes me an hour to finally fall asleep. Well, listen, I mean, if you can't get sleep, do more of those paintings, Rusty, because I loved your paintings. Thank you for sharing those. So what have we got here? Mrs. Marie Reynolds from Jersey says, I suffer from insomnia since I was a child. I will not take medication. That's too scary. A lot of people are concerned about medication, especially the addictive nature of sleep medication and also the side effects associated with them. So obviously consult your physician about any concerns you may have. So I ain't the walrus. My name is Sharon. I'm having intense dreams, not necessarily negative, but so intense. You know what, Sharon? A lot of people are saying these lucid dreams, this where you actually know that you're dreaming or you're in the dream. And even if you wake up and you fall back to sleep again, those dreams are coming back in. That's probably because you've got a lot of time to reflect during COVID-19 and your brain is just picking up that subconscious information that you've had during the day and just processing it as you try and sleep. What else do we have here? I'm working from home since March. And I have taken a few naps. Absolutely, Rhoda. People are sleeping during the day because, you know, the boss isn't around. Your bed's there. It's looking very tempting. No Zoom, no WebEx, a couple of Z's for an hour. But what we're doing is we're expending that sleep momentum, which we could have used at night. And therefore, we're sleeping a little bit later, waking a little bit later. Or if we're waking at the same time, then we're not feeling refreshed because we've kind of used some of that sleep time during the day. So that is an issue. So remember to sleep on time. Hi, Natasha from Kent. I had undiagnosed sleep apnea, and the monitor said I stopped breathing 115 times an hour. I now have a CPAP machine. If I get COVID, will it affect me more with sleep apnea? You know what, Natasha? Those with respiratory conditions, such as sleep apnea, or those using CPAP machines, will be at risk of coronavirus. So stay safe. Remember to maintain social distancing, hygiene, and if your GP has sent you a shielding letter, then you know what to do. Quarantine. I'm happy as a clam, not going anywhere. And here I thought I was always an extrovert. Well, look, Jenny, I think a lot of people are very happy in COVID-19, and I'm glad you are too. Stacey Donnelly, she's saying essential workers, extreme hours in healthcare gave massive effect on the sleep patterns. I found great relief from Riker and breathing exercises, great escape before bedtime. Absolutely, I think the stress from essential workers has been absolutely immense, and a lot of studies coming out of China and Europe about post-traumatic stress and those working with COVID-19. Mary Blair, do you recommend melatonin? I think it depends. It depends. You know, if you're in the States, you can purchase melatonin. You can try it out. It's not going to do any harm. In the United Kingdom, you do need a prescription for it. So there's a little bit more restriction on that. Excuse me, I have a little bit of a drink. So I don't think there's any harm in trying it. You know, why not? Mary Rosa, if I'm hot while I sleep, I dream more, and these areas of the brain connected. Well, look, it's interesting you should say that, Mary, because temperature is one of the external stimuli, like sound and light, that affect your sleep. Listen, when you're cold in the middle of winter, you sleep like a baby. People will struggle to wake you up in the morning because when it's cold, your core body temperature drops, and like most animals, when their core temperature drops, they begin to kind of hibernate, and that initiates sleep. While in the hot weather, we really struggle to sleep. You know, if it's really, really hot, like in Arizona, you got to turn the air conditioning on. You know, you don't want to have any blankets on you. So if your temperature is a big external stimulus, that will impact your ability to sleep well. So yeah, absolutely. Christina says, dreamer can also be influenced by external factors such as movement or heat. Can also be, yes. So we mentioned the light, we mentioned the heat, we mentioned the sound, and also if you're exercising, you're boosting some of those natural serotonins that will help you drive your sleep forward. Excuse me, I'm gonna have another drink. Excuse me, 1 minute. Okay, let's have a look. Hannah May saying, saying hi there. Hi Hannah, how are you doing? I find that or will this just make me depressed? No, stress will make you more resilient. We know that if we sleep deprived soldiers, they have less capacity to deal with stress and invariably perform less. So if you sleep better, you're able to take the next day forward. What your brain is doing is detoxing, debulking all the information that's taken on board from the day before, making it feel refreshed, making you feel nice and bubbly to take on more material. But if you're sleep deprived, if you're looking after a young child and you're up and up every couple of hours, or you're like hanging, it ain't gonna work. But if you can get some sleep and refresh, reset the system, then you're going to be in a much better position to tackle on everything else that you've got to worry about. Juicy says, my neighbor chants every day, all night, and I can't sleep. Dr. Berg does stuff about sleep disturbances, sleep paralysis, and deliverance. Well, listen, I think that's more of like a social issue. I think if someone's causing you to not sleep because of sound, remember sound is one of those external stimuli, then you got to talk to your local authority and see what's going on there. So I'm struggling with my hands, says Miss Simpson. I'm waking up clenching my fists. I can barely open my hands some mornings. That's an example of sleep paralysis, similar to what Miss Sulalali was saying about waking up in night terrors. Again, it's probably the stress of everyday life seeping through into the subconscious, and it's a matter of attacking the stress points. There's no silver bullet. We have to address the social stresses directly and find the solution. Rusty saying a comment for Mary. I'll leave you guys to it. Steve saying, I think my issues are a combination of years of shift work. Yeah, absolutely. I think shift work is one of the deadly sins when it comes to sleep biology. A lot of studies on people who work in the airline industry, nurses who work shifts, how that impacts, a lot of different aspects of your life and health. So, yeah, one of the big contributing factors to all sorts of ills is going to be shift work. Jenny says everyone can march in place and use isometrics for exercise. Absolutely, absolutely. Um, my sleep involves me waking up and sleeping with my fist clenches. We've had that one. Okay, let's scroll down. Let's scroll right down. Let's have a look. So many questions. Everything that we've discussed here. But remember, I wanted to let you know tomorrow, GMT, LBC Radio Digital at 8:45 in the morning, London time. Go there, listen to me talk, and we'll be producing a lot more pop videos and more chats to come. Until then, everybody stay safe, and we'll speak soon. Take care. Bye bye.